We presented the data at the Amsterdam Cancer meeting in September, and this is an exciting workshop, an ESTRO workshop organized as a pre-meeting workshop for the EBCC here in Glasgow, Scotland, UK. We presented roughly the same data, but we elaborated a little bit further on the number of patients that we really need to treat to obtain the desired effect. We find that for the overall group of patients, regional radiation therapy after surgery, systemic therapy, improves the rate of or the chance of living without metastasis, without recurrence, and improves slightly at long-term follow-up the overall survival. In our study, which was conducted from 1996 of last century to 2004, all patients, or the big majority of the patients, had full axillary surgery. So that means that the axillary part of the regional lymph nodes was removed by the surgeon, and the radiation therapy was only directed to the non-surgically removed lymph nodes, which are the lymph nodes just below the clavicle, just above the clavicle at the median site, and those lymph nodes which are behind the sternal bone or the breastbone. We compared this together with the Danish study, which has been presented now, and the Canadian study, which was presented also here at this workshop. And you can see that overall the results are pointing to the same direction. Optimization of local regional treatment really decreases the risk of subsequent distant metastasis and thereby improves overall survival in breast cancer patients. That's indeed the big challenge of this study, how to bring the results of those studies into daily life. Because one of the criticisms between brackets that are often heard is we give much more efficient systemic therapy, chemotherapy, hormonal therapy, so the radiation therapy to the regional lymph nodes, it's not needed anymore. And what we have shown now when we compare the three studies as they were presented is that when you give more efficient systemic therapy, that the role of radiation therapy to the regional lymph nodes might even be more important, might even increase. We are not in a competitive world, we are in a multidisciplinary world where an optimal combination of local regional treatment, surgery, radiation therapy, systemic therapy will give the best results for the patients. A synergistic effect on the tumor patient level. We do not combine it in time, because then you also get a synergy in toxicity. But if patients are treated optimally by chemotherapy and hormonal therapy, they will benefit more from optimizing surgery and radiation therapy. On the other hand, when your local regional treatments are not optimal, your systemic therapy will also not lead to the desired optimal effects at long-term follow-up. Regional radiation therapy in breast cancer seems to be very important, much more important than we thought, and increasingly important with improvement of the other, namely the systemic treatments.